I'll start off the same way that I start off normally, just kind of giving an update of where we are at nationwide. Currently now we are at 737,000 plus cases worldwide, 35,000 global deaths. In Florida, we're at 4,900 Florida cases with 60 deaths. But of all the deaths that I have just made mention of, we have 156,000 individuals who have recovered from COVID-19. It's my hope that everyone will continue to practice social distancing. I know that we have been on this journey together for about 2 weeks now, and 2.5 weeks. But if we could continue to practice social distancing and following the orders of the various municipalities in which you live in, that would be great. I do want to say one thing that I saw on Facebook of individuals in Fort Lauderdale who blocked off an entire street. The police were out there, individuals were hurt, one individual was killed out there. I'll be very honest, I think it's irresponsible that this is what we're doing in our communities. The only way we're going to be able to combat this together, and it's my hope that you all will follow the rules of the state in doing that. With that being said, of all the people who we could have to come speak today, we have a very close friend of mine, and so happened to be our ag commissioner for the entire state of Florida. Been friends for a very long time, and she is really in the front lines and have been in the front lines on this issue. And she has a lot under her belt to deal with when it comes to COVID-19. So I'm going to give her the floor, and I'm going to allow our Commissioner of Agriculture, Nikki Freed, to address you all, to speak about what her department is doing to help during this time. Nikki, it's all yours.
Thanks, Jeff. It's definitely, I missed my 305 and 954 people, but I'm up here in Leon County.
Yes.
Really, we're all in this together. And I think that you're hearing that from all of your electeds, and you're hearing that from all across the state. So I just want to kind of give some updates of what we are doing in the Department of Agriculture, because we really do encompass so many different facets. We have 19 different divisions. I was on a conference call with all my division directors this morning. Everybody is still, everybody's teleworking if they can, but we have a lot of people that are in the fields that are making sure food safety and the regulations that are on the farms. All of our ag law are on the streets, helping with some of those checkpoints that are on the highways that are coming into it after the governor had said basically hot spots, they need to be quarantined. And our ag law guys are still out there checking all the trucks that are coming into our state to make sure they're not bringing bugs and pests from other parts of the country. But one of the other things that we are really focused on is the food nutrition program. As the schools started kind of looking at, they were closing even before everybody had the shutdown, my team was already working through, because we already had 23 counties that had already had some type of either an outbreak or at least 1 or 2 cases. So my team was already working through trying to get the USDA waivers to make sure that we could open up our summer break spot locations, which is what we did. And now that we have school closures across the entire state, my team has been working overtime, working with every single district, coming up with a plan. What it works best for Dade County is going to be different than what's happening in Sumter County. And so we've been working with each of the school districts to figure out where are the best spots, making sure that if they are doing breakfast and lunch, is it just for one day, or can a family pick up for 3 straight days? Some communities where might be more outstretched, and maybe kids that are getting bused into those schools or have further distances to go, we've recommended to a lot of our school districts to start just putting the food right onto the buses and then transporting that on the same typical bus loop. So we're constant checking in with our superintendents and all the people that are in charge of the program. It's called Summer Break Spot. And so they are the ones who are kind of really stepping up to all your, thank your teachers, thank your school board members, thank everybody who is really still, while school is closed, they are still out there preparing foods, coming up with plans of how to distribute food. If you need to know where the closest summer break spot is to your community and to where you are, there's 3 ways of doing it. One, you can call 211. That's the easiest way. We've got people 24 hours a day, 7 days a week, taking phone calls. Number 2 is you can go onto our website, which is summerbreakspot.freshfromflorida.com. Or you can text 211-211 and text that is FL kids meals. So those are 3 ways that you can get directly knowing exactly where those locations are. We also have a vital role to play when it comes to the food banks. One, all of the money that comes from the federal government to help with the food banks, we pass through and then we coordinate with each of our food banks in the communities. So we kind of get knowledge of what communities need more, need less, who's up and operational. And that is so vital because, as we know, they already serve so much of our community. But unfortunately, when we start seeing these unemployment and underemployment numbers rising every single day, we know that there's so many more mouths that we have to feed. And unfortunately, most of these food banks get 80% of their food from donations. That's from individuals, that's from restaurants, that's from food stores, and all of those donations have basically ceased. Because everybody is, unfortunately keeping all the food to themselves. Food stores they're selling the foods faster than they have, than they would have otherwise. And obviously restaurants are just ordering enough for their takeout and home delivery. So they're not, making a whole bunch of extra meals, hoping that people are coming into the restaurants. So it's really important for everybody who's listening that if you were one of those people who went out, 3 weeks ago and hoarded every single can of soup in your food store, it's really important that you go back and you give back now, or if you can't, or if you're getting your $1,200 check and you don't need it, maybe think about depositing the money and going out and buying food to your food banks or donating that money to your food banks. This is a really important opportunity for us all to come together and realize that there's going to be a lot of people suffering. And now these food banks is the only way that they're going to get nutritious meals. And I also say that too, when it comes to the people that are on WIC. When you're on WIC, you only have certain types of brands that you can buy. So if you're going to your Dollar General or some of your other, pantries in your communities, and you are hoarding and taking up all of that food, when a parent comes in that's on WIC, they can only buy certain types of food. And if that food is not on the shelves, that family goes hungry. So we're really asking everybody, please don't hoard food. The food stores, as you see, are staying open. We're in constant communication, not only with the Publixes of the world, but also our ag growers. So the food supply chain is constant. It's steady. It's just taking our food stores a little bit longer to restock. Publix has had to increase, and they typically have 2 trucks going out to stores a day. They're going 6 to 8, 6 or 8 a day. So they're stepping up their inventory. All of our ag are stepping up their production. They've all asked for waivers of moving their trucks and the amount of food that they can put on the trucks because they're trying to get it out faster. So please don't hoard food. It's not necessary, and all it's doing is hurting your neighbors who are going out, and especially those that are elderly or have shot immune systems. They pick specific times to go out once a week, and if they go out that day and there's no food there, they're really in trouble. So please be conscious of your neighbors. The other things that we do is we spend a lot of time with USDA, FDA, kind of just getting updates of what's happening across the country. Still recommending everybody that that we hear a lot about, is the food supply safe? And I'm going to tell you it is. There's been no evidence whatsoever that you are able to catch COVID-19 and by food. But in the same respect, make sure that when you're bringing in boxes to the house, you're bringing groceries, you're just cleaning off the surfaces. You're making sure that if you've got fruits and vegetables, that you're cleaning them and washing them, which is what you should be doing anyhow. The other big component, and I know I'm talking a lot, but the other big component.
Keep going. No, please. Trust me, people are asking questions, so go, take it.
The other really big thing that is part of our job that most people don't understand is the consumer component, the consumer services. And so we deal a lot with the fraud and scams that are happening. Price gouging is more the Attorney General's office, but if we get those calls in, and we handle about 400,000 calls typically in a year. So we getting those calls in that have more to do with price gouging, we send them over to the Attorney General for investigation and potential prosecution. When it comes to fraud and to scams, we handle all those. And so we've seen an uptick, unfortunately, but this is, we see that all the time. I mean, you saw that after the hurricane, how many of the nonprofits, jumped online to help the Dorian victims and were fraudulent. So we're seeing a lot of that happening too, especially when we're seeing that there's no supplies of toilet paper or hand sanitizers. So everybody's desperate to get them, and they go online, they see a great deal. I've got, months worth of toilet paper or hand sanitizers. People go online, they pay for it, and it never comes. and it was complete fraud. We're seeing a lot of that too, with everybody being home. We're seeing people coming up to people's homes saying that they're Comcast or FP&L, they've got a new great deal for them. And it's not true. They're not representatives of the company. We're also seeing, everybody's waiting on some of the new federal bailout dollars. Different companies saying that they're going to help get the checks faster, but I need a deposit up front. Please don't do that.
Can you talk more about that, Nikki, as far as individuals who are using the stimulus package to incorporate their company, insert their companies into that?
Yeah, so there's, we all know that there's always companies out there. Well, we'll help you get your loan. We'll help do your taxes. You see all that, pop up regardless. Now you're seeing companies saying, we will help you get your loans faster. We will help get your stimulus package faster. Maybe there are some good reputable companies out there that legitimately know how to work with some of the federal loan programs and know how to kind of work through the SBA loans, or if you're in the farming community, some of those assistance programs. But we really recommend you do your due diligence. Make sure that you are going online, you're checking out the companies, you're finding out that they are actually valid, that they're registered with the state or with the federal government, and that you're doing your due diligence, because there's going to be a lot of people who are going to want to take advantage of people now. And especially if they're asking for money up front, or if they're asking for a lot of personal information up front, 9 out of 10 times, they're scamming you. Don't give out money. Don't give out your personal information, and just be smart, and you can also go online. If it's a charity that's trying to ask for donations, we have Check a Charity that's on our website, which is fdacs.gov, which is fdacs.gov. And we have all the information on there where you can check out to see some of these companies and see if they actually are valid. And if you have a problem, you can also go onto our website and also report any of these, and we will have somebody out there almost immediately to investigate and look into this.
So I really appreciate that. There's some questions. Nancy Fry asks, how do we safely donate food to the food bank right now?
Most of your food banks are up and operational. So if you just give them a call or go onto their websites, everybody's still taking deliveries. I was actually this past week over at Second Harvest, which is the big food bank here in Leon County. My team was packing boxes, and then the next day we gave out to over 1,000 families here in Leon County. So there's still ways, all you can do, either one, if you want to financially donate, all of them have websites, and you can go directly onto their websites and give a financial donation. If it's food, all the food banks are still collecting them, and they're all working on social distancing, so they all have different drop-off locations and different ways to make sure that you're not putting you in harm's way.
Pastor George Rich said, not sure if it was covered already. Can Commissioner Freed provide a status on the state's activation of the disaster SNAP program?
On the state side, so we don't actually oversee SNAP. Unfortunately, that is with the Department of Health and DCF. So they really deal more with those kinds of not like SNAP programs, and WIC are all done through a different sort. So I'm not quite sure if disaster has been activated for SNAP, but I know that's something that my team is obviously, we're not just because it doesn't quote unquote fall under us. We are actively making sure that we are engaged in those conversations, because we know that there was some problems at the beginning with SNAP, and especially going to the food banks and using SNAP benefits, and not just at food banks, but also at farmers markets, because now more communities are doing the farmers markets than anything else. Hi, Pastor Rich.
So let me ask you a question, Nikki. I think the biggest concern with most Floridians right now, and I know you've been speaking about it. How do you think we as a state, how do you think we're responding to all of this?
Unfortunately, and I've been very vocal, that I think stay at home, or, at the very least, shutting down all non-essential businesses is critical to our state. I've been asked a lot, why, New York's not doing that, and only shutting down the city and not in, the island, as opposed to the whole state. And I said, well, Florida is very different. We travel all across the state all the time, everybody. If you just lock down Dade County, everybody's going to go to Broward. If you just lock down Broward, they're going to go to Martin County. They're going to travel throughout the state. And unfortunately, that in order for us to get this under control, we got to stay at home. I even said on MSNBC, when you go to the doctor and you're sick, your doctor gives you your prescription, and they don't anticipate you taking half of it in order to beat the illness. You take the entire prescription, and it's really time for Florida to take the full prescription, for us all to sacrifice together, us all to stay home. I'm just as worried about the economic impact as the rest of us, but if we don't stop it, it's going to take longer for us to be able to restart our economy. We all stay at home. We all do this together. I even heard from earlier today that, now that Palm Beach County, I think, is shutting down, people are going to Okeechobee, and they're going over there. And even in our rural communities, all it takes is one person to have been infected that's traveling the state, going into the convenience store that day. And now, even if it's a small rural community, somebody potentially is infected there, and that takes out the whole state, that whole county. And so I do think that this piecemeal approach is more harmful than it is doing good. And it's confusing. It's confusing. I'm a Dade girl, I'm a Broward girl. You have one issue in the city of Miami, you got one thing in Dade County, you got one thing in Broward, you got something different in Tamarack and Fort Lauderdale, and you've got all these different things. And how do you know what's what in which areas? And it's really confusing to people. It's confusing to businesses. I mean, I was on the phone with Publix twice last week, that they had one issue in Coral Springs and one issue in Miami Lakes, different ordinances that were being passed and having different unintended consequences to some of those essential businesses. And look, we're seeing those numbers, you and I were talking before we got on, tick up so high. And it's going to continue. And I've talked to a lot of our medical experts that are already hearing. I mean, I have some really good friends that, are both she and her husband are in medical up in Duval County. They don't have the right equipment. They don't have the ventilators. They don't have the PPEs for their own doctors. And so we're asking our doctors and our nurses to put themselves in harm's risk. And, I keep, I go back to my grandmother's 90 and my mom just went through a year of chemo. I've told them both, you've got to stay at home because I can't protect you. I said, Grandma, if you get this and you need a ventilator, but there's some other person who's 30 or 40 years old, we might get to a point, you're not going to get the ventilator.
Right.
And it's going to be somebody else. And there's nothing that I can do about that. And so that is, and it's not trying to be scare tactics, it's just trying to be smart, to look at the numbers and to realize that our healthcare system, that if we are projecting on the low end, potentially 200,000 people who need beds, and we've got 33,000 beds in the state of Florida. And that's not even taking into consideration what happens on a normal basis. People having heart attacks and strokes and car accidents and other types of medical emergencies that are going to require the medical side of things to be so overwhelmed that you're not going to be able to handle this properly, and you're going to be picking and choosing who lives and who dies and what happens to those other emergencies that are coming into your ERs. So I do believe that it's not too late. I've called upon the governor to please to shut down the state and to do stay-at-home orders. And like I said, at the very least, do closing of non-essential businesses. It's the only way for us to do this together. Our state relies on tourism for our economy. And if people aren't traveling to our state, and if we don't have this under control, people aren't going to come back to our state. So we need to take this and really kind of stick together and get through this together.
Let me, we have about 10 minutes left. I want before I get, there are like 3 or 4 questions that people have asked. How have this become a political issue though? I mean, I read something that said the Democrats that we're trying to shut the state down. We're trying to shut the state down, and it's not best for the. How has this become a political issue?
I don't know, considering that across the entire country, we've got 21 other states that are shut down. A good handful of them are Republicans. So, but unfortunately, those that are speaking up the more vocally in our state are Democrats. And I have tried very hard that this is not a DRR thing. This is a human issue. This is a state of Florida first. And, I've tried very hard to not make this a political thing. I'm more moderate. I'm fiscally responsible in everything that I talk about and I do. But it shows the bigger picture of what's happening in our country. that everything that's done is in a partisan lens. And we've got a lot of healing to do, because that is not how our country is supposed to operate. Of course, you're going to have political differences, and that's why you have parties. But when it comes to a health crisis and like this, we should be listening to the experts. I'm not doing this because my political belief tells me this. I'm watching the news. I'm hearing experts that are in healthcare. I'm talking to economists. I'm talking to, I'm not making this decision because, I'm commissioner of agriculture and I feel that this is what I believe. I'm basing my thoughts on what I'm hearing from the communities. I mean, I'm looking at social media, how people are nervous and people are scared. And what I'm seeing, I mean, the fact that St. John's only closed their beach last night, and we're still seeing people storm the beaches. That's not a DRR thing. That's a human rights issue. That's a human issue. And it saddens me that's the case. Because look, and I've also said this too, I hope I'm wrong. I hope I'm wrong. I hope the governor, and I will be, I hope I'm wrong, but hope isn't a policy. And unfortunately, if he is wrong, the devastation on our state will be felt for a generation. And I really believe that I'd rather take our approach and be cautious and save lives than his approach, because his approach, if it fails, is going to cost lives.
And right before we go, there's Melissa Ward has a question. She says, "Hey, Rep. Jones and Commissioner Freed, any plans being developed to deliver food to food insecure homebound seniors? Perhaps some sort of partnership with Meals on Wheels, which likely has infrastructure already in place."
Yeah, that's a big thing that we've been working on with DCF. Because in elder affairs, because what we are concerned about is those meals, those programs are not up and running as fast as our school lunch program. And so we have a lot of seniors, obviously, that are staying at home, and not just, ones that are on any kind of Meals on Wheels programs, but also the ones that just, can't go to the food stores. How are we getting that? So we are definitely working on, and a lot of corporate partnerships too. We have a lot of corporate partners that are wanting to step up and do delivery services. So we are actively working with all of them to take care of that vulnerable population.
Last question from our good friend, Nick Harris.
Hey, Nick.
She said, "Commissioner, and you spoke about this, but I think, Commissioner, I think it's really important that you harp on this again." She said, "Can you talk about the food supply chain? People are hoarding because they are scared and see empty shelves. Can you discuss why this is unnecessary?" I mean, I went to the store yesterday and people are really hoarding food. And can you really speak to this and why it's unnecessary for people to do this?
Yep, absolutely. So first of all, our ag producers are, and I'm going to say this every time, our ag producers in the state of Florida are the best in the country. I'm on calls with them every 48 hours to see where they are in the supply chain, where they are in the manufacturing. We are not seeing any slowing down, if anything, picking up of what they're producing. I've also been in contact between our national partners, USDA, FDA, our food stores and chains, and I have not heard one issue with the food supply chain. So the issue is being able to quickly stock up enough. And that's why you've seen Publix closing down a little bit earlier at night, opening a little bit later in the mornings, just to give them an opportunity to stock back up. I mean, I was at the food store yesterday. I got everything I needed. They had the meats, they had the chickens. The only thing they didn't have was toilet paper. I don't know what's the big deal about the toilet paper thing. I don't really get that. But that's the thing. But the toilet paper, everything else was there. Right, like I don't get it. But now I don't have toilet paper, But besides that, really the supply chain is there, so there's no need to hoard food. The food stores are on the essential list. The food stores aren't going to close down. They're all taking the proper precautions to make sure that the stores are sanitized, to make sure that they're not, conglomerating at people in front of the meat deli section or in checkouts. So they're doing all the appropriate protocols. They're not going to be shut down by any means. So there's no need to hoard food. All you are doing when you are hoarding food is requiring you to get an extra freezer, which is more expensive. And it's preventing your neighbors who need to feed their families from getting access to it. So please don't hoard food. If you already hoarded food, go donate it to the food banks, because they're the ones who need it.
Listen, all right. Here, one last question. We have 2 minutes left. Someone asked, why is guns considered an essential business? Gun stores considered an essential business?
Yeah, I've heard that a lot too. That's actually coming from the federal government. That's from the Department of Homeland Security. That's on that list. And so we're seeing that in a lot of our communities that are shutting down. They're following the Homeland Security's list, which is guns and ammo. So that's kind of where it is. And so we're seeing that, and we're seeing an uptick and all of the purchases. I mean, you're seeing the stories from all across the country where people going out and buying more guns and more ammos. And what I say to that is the same thing I talk about hoarding on food. Not necessary. You know, the gun stores are obviously open. You know, there's no need to hoard guns and to hoard ammo. You know, we're still a civilized society. And that will stay that way as long as everybody keeps a level-headed mind that we're going to get through this. Everybody just needs to take their own precautions, stay at home, only travel when you need to, and check in with your parents and your grandparents. They are the ones who are really struggling right now. I'm even talking about getting an iPad for my 90-year-old grandmother so she can. She's so sad that she can't go to the Hard Rock right now and to Coconut Creek. So we're trying to find other ways for her to play her slot machines and her poker, and doing that online and be able to FaceTime with the rest of the family. But our seniors and mental health is going to be a real issue with everybody staying at home. But that's why we've got modern technology and really an opportunity to, spend time, do all these Google, the Zoom calls, the family members. And it's really important that we're checking in with all of our loved ones, even more so than you may do on a normal basis.
As we close out, I know we spoke about business. I'm big on like encouragement and inspiration. Where's your hope for all of us?
My hope is that we all are taking this seriously. We're going to get through this. The citizens of our state are so resilient. I mean, we deal with the scares of hurricanes every single year. I was down in Miami. I lived through Andrew. You've got people up here in the Panhandle who lived through Hurricane Michael, and down in the Bahamas, I know it was impacting your family through Dorian. And we get through these things. We pull together. We're resilient, we're fighters, and this is going to be just the next challenge. But I know we're going to rise to it. You've got a lot of amazing elected officials that are both local, that are going to help to make sure that all of our people are safe and financially secure when we get through all of this.
Oh, thank you so much, Nikki. Listen, everyone, this is Nikki is my friend, and she is our Commissioner of Agriculture for the state of Florida. I love you so much, Nikki. Take care of yourself.
Awesome. Thanks, Chev. Appreciate your time today. Thanks, everyone.
All right.
Be safe, everyone.
Bye. Bye.